Hi, everybody. I'm Rachel Gross. I am coming to you from Data Support, Ryan White Data Support. And today we're going to have the webinar on the Part B and B Supplemental Expenditures report. So we will provide step-by-step guidance on how to do these reports. If you have questions, we will have a question and answer period in the end. So you can type your questions or save them till the end. Another option besides typing them is to raise your hand at the end, and I will call on you, unmute you, and let you ask your question live. I think that's it. So I will hand it off to you to Christopher Vanderkay, who is going to lead the webinar today. Hi, Chris.
Hey, Rachel. Thanks for that introduction. And thank you, everyone, for joining us on today's webinar. So in today's presentation, we will go over how to complete the Part B and Part B Supplemental Expenditures reports. We'll begin with some quick background information about the expenditures report before moving on to how you would access the expenditures report. Next, I will go over in detail how to complete the expenditures report, followed by showing you how to validate the report. And then finally, before I close out the presentation, I will review the TA resources available to assist you with your submission. So before we continue, I do want to make everyone aware of the Part B and Part B Supplemental Expenditures Report manuals on the RWHAP website. So these manuals are invaluable resources to use while completing the expenditures report. The Part B manual is currently available, but we are still editing this year's version of the Part B Supplemental manual. So that should be released prior to the opening date of that report. So let's start off today's presentation with a little background information about the expenditures report. So all Ryan White Part B and Part B supplemental recipients must complete the expenditures report. This report serves as a reference for how recipients expended their grant funding during fiscal year 2025. The expenditures report is an annual report completed through the HRSA electronic handbooks, or EHBs, where recipients report on the expenditure of their grant funding for the year. So let's now move on to reviewing how to access the expenditures report. Please note that these steps are the same for both the Part B and Part B supplemental expenditures reports. So recipients will first need to log into the HRSA electronic handbooks, also known as the EHBs. On this slide, we are at the EHB's landing page on the grants.hrsa.gov website, where you will see a list of login links. Go ahead and click on the applicant grantee box at the top left of the screen. So the next page will direct you to sign in using your login.gov or id.me account. Go ahead and click the login button shown here. Next, you'll be prompted to enter your credentials for the login method of your account. You will then be asked to enter your two-factor authentication on the next page. Once this is completed, you will be taken to the EHB's home page. So from the EHB's home page shown here, your next step will be to hover over the Grants tab at the top. And then on the drop-down menu that appears, click on Work on Other Submissions under the Submissions header. So that's going to take you to the Submissions All page, which is going to look a lot like the one shown here. Scroll down to find your list of submissions. In this list, you can locate your 2025 expenditures report, which we can see right here, and then select the Start or Edit link under the Options column. So this will then take you to the expenditures report inbox, where you should see your organization's report listed. Clicking on the envelope icon under the Action column will open the report. If this is your first time opening your report, the icon will say Create as shown on this screen, but if you are returning to your report, it will instead say Open. So now that we have accessed the expenditures report, let's walk through completing the report for both Part B and Part B supplemental recipients. The expenditures report is comprised of 3 sections and begins with the recipient information section. This will include general information about your organization. Next is the file upload section. But I do want to point out that for Part B and Part B supplemental recipients, there are no required files to be uploaded for this section. And then lastly is the expenditures report. This section includes a breakdown of the funding expended during the budget period by service category. Back in the expenditures report, after clicking on the envelope icon, you'll be navigated to the first section of the report, which is the recipient information section. You must provide a response for every field with a red asterisk. Start by filling in any missing address or organization information not pre-populated already in the web system. Further down on the recipient information page, fill out the contact information of the person responsible for the submission. The information listed here populates from the information listed in the HRSA EHBs. Therefore, we recommend reviewing the information listed here for accuracy and saving it if you have made any updates before moving on to the next section. So as we mentioned before, the next section listed in the expenditures report is the file upload section. For both Part B and B supplemental expenditures report, there are no required uploads, so we can go ahead and quickly move on to our last section of the report. So here on the expenditures report section, I will begin by reviewing the Part B expenditures report, and then I'll go over the Part B supplemental expenditures report. I do want to emphasize that the data entry is completed entirely in the expenditures report section. All the fields require a response, so if you have no expenditures to report, enter a 0. When entering your expenditures, please remember only whole number answers are allowed. The Part B expenditures report includes 4 components. You will begin with the award information shown here, where you will enter the amount expended toward each award category listed in the table. Each column represents a different funding source, which are the prior year carryover and the total award amount. I also want to point out that the non-editable fields included in the award information are automatically calculated once you have saved the expenditures report section. So next is the Part B expenditures by program component. For this section, you will enter the amount expended for the listed services using the 3 funding source columns shown here: base award, ADAP base plus ADAP supplemental, and emerging communities. All 3 columns include fields where you will enter funding amounts under carryover and current award. For example, in this first row for ADAP services, under carryover, you will enter the approved amount of Part B base award carryover from the previous budget year that was expended on ADAP medication purchases in the current budget year. Under the current award column, enter the amount of your agency's Ryan White Part B base award that was expended on ADAP medication purchases. Previously, recipients primarily reported expenditures towards health insurance and cost-sharing assistance and home and community-based health services in these 2 rows here. Expenditures for both service categories from all award types are now going to be reported with the rest of the core medical and support service categories, which we will get to on the next slide. So this component of the expenditures report is the Part B expenditure categories, which includes the core medical and support services. For this section, you will enter the amount expended toward each service category for each funding source, which are consortia, direct services, emerging communities, and prior year carryover. Further down on the Part B expenditures report is the Part B MAI award. For this table, you will enter the amount expended on each service listed for each funding source. This includes carryover in the left column and the reporting year award in the right column. Under the MAI award table, there is the 75% core medical services requirement checkbox that you will select if you did receive a waiver for this requirement. For Part B recipients, under the MAI table, there is a legislative requirements checklist for your reference when completing the report. You can quickly view the capped amounts that pertain to each legislative requirement once you have saved your expenditures to make sure your agency is in compliance. For this first part of the table, you can double check that at least 75% of your total award, not including clinical quality management, recipient administration, and planning and evaluation, was expended on core medical services. Further down on the checklist, we have the requirement for clinical quality management, where the total amount expended must not exceed 5% of your total award or $3 million, whichever is smaller. Then we have the requirement for planning and evaluation / recipient administration, where the total amount expended may not exceed 10% of your total award. The last section of the Part B expenditures report shown here on this slide is the certification of aggregate administrative costs table. This section must be completed by your agency's financial officer or designee. Recipients will not be able to submit their report without completing this section and certifying their subrecipient's aggregate administrative expenditures amount. So now that we have gone over the sections for the Part B expenditures report, let's review the Part B supplemental expenditures report. This is also accessed from the left navigation panel in the report and includes three components, which begin with the award information that includes the total award amounts for the Part B supplemental grant award and Part B supplemental carryover. The next component listed underneath is the Part B supplemental program total. This is where you will enter the amounts expended for the services listed in the funding source columns for total carryover and total award amount. Unlike the Part B expenditures report, health insurance premium and cost-sharing assistance and home community-based services are entered directly in the program total table here, unless it's consortia funding. For this table, the non-editable fields will automatically populate once the report has been saved. So the last section of the Part B supplemental expenditures report is the Part B supplemental expenditure categories, which includes the core medical and support services. For this section, you will enter the amount expended towards each service category for the two funding sources, which are consortia and direct services. Only consortia funding for AIDS drug assistance program treatments, health insurance premium and cost-sharing assistance for low-income individuals, and home and community-based health services goes into this table. If the funding came from a different funding source for those three categories, the amount should be entered into the Part B supplemental program total table. So below the Part B supplemental expenditure categories, there is an additional table that will automatically calculate your core medical and support service expenditures once the expenditures report is saved. This table can be utilized to make sure you are in compliance with the 75% core medical services requirement. If you did receive a waiver for this requirement, just like before, you can select the checkbox below the table. If you're unsure if you've received this waiver or have any questions, please reach out to your project officer. So now that we have gone over completing the expenditures report, let's review validating and submitting the report. The following steps apply to both Part B and Part B Supplemental Expenditures reports. So once you have completed the expenditures report, you can move forward with validating your report by clicking on Validate in the left navigation panel. The system will let you know that it is processing your validation request, and it may take a few minutes to complete. You can refresh the page to see your results by clicking on Validate again using the navigation panel or refreshing your browser. So there are 3 types of validation categories that may show up in your validation report when you run it: errors, warnings, and alerts. Errors must be fixed before you submit your report. Warnings are validations that should be corrected, but if they cannot, then a comment will be required to address them. And lastly, alerts should be reviewed and corrected if possible, but you may still submit your report with an alert. So now that we have briefly discussed these types of validations, let's go back to the validation process. So once your validation request has processed, you will see results as you see so here. So in the example listed, we see that there is a warning validation message. To add a comment to a warning, you will select on the Add Comment link under the Action column. Once you have addressed any error, warning, or alert message, you can move forward with submitting your report. Remember that if you make any updates to your report in response to your validation results, you'll need to validate your report again before submitting. Just click the Validate link in the navigation panel to start the validation process again. So once you have completed all the required sections, you can move forward with submitting your report by selecting the Submit option in the navigation panel. Selecting Submit will bring you to the submission screen where you will be required to enter a comment regarding your submission. Once all comments have been entered, select the box stating that the data in the report are accurate and complete. After that, click the Submit link to submit your report, and you have submitted your submission has been sent to your project officer for review. So let's end the presentation by reviewing some helpful TA resources to use while completing the expenditures report. Our online resources can be found on the RWHAP website. On the recipient resources page, you can find all of our materials, including those for the expenditures reports we talked about today. The RWHAP policy notices page has a ton of great information, most notably PCN 1602, which we didn't really go over today during the presentation, but that document has the definitions for all the various core medical and support service categories and is the best resource if you have questions about those definitions. Now, I do want to take a moment to also mention that the HIV Resource Hub. The new HIV Resource Hub will be replacing Target HIV later this year. In the interim, resources and materials are posted on either the RWHAP website or the CAI DISC website. Please stay tuned as we will be sharing more information about the new HIV Resource Hub in the coming weeks. So this may feel like a lot to do, but there are several technical assistance resources available to help. The Ryan White TA Resources brochure outlines information about each technical assistance provider, including the reports they support, frequently asked questions they respond to, and their best contact information. Most importantly, please don't forget that there is no wrong door for TA. If we can't assist you, we're happy to refer you to someone who can. To learn more about the Ryan White program, check out the HAB website at the link on the slide. Please also be sure to sign up for the Ryan White HIV/AIDS program listserv. HRSA is on 5 social media platforms. We encourage you to follow along and share our content on X, Facebook, LinkedIn, and Instagram to stay up to date on the latest HRSA news. Our account handle on each platform is @HRSA.gov. Additionally, we also encourage you to sign up for HRSA's e-news, a bi-weekly email of comprehensive HRSA news, and to sign up for HRSA press releases. You can also visit our website at www.hrsa.gov for more detailed information about all of our programs.